Leap Health is in the business of acquiring, managing, and growing market-leading home healthcare companies. And today we're joined by Chris Dobbin, the CEO and President of Leap Health. Chris, thank you so much for joining us.
Thank you for having me.
So let's begin by discussing how 2018 fared for Leap Health. Give us a review of how the year went by for you.
Sure. 2018 for us was really a year of growth. We had ended 2017 with a couple acquisitions in September and October where we entered into both Rhode Island and Vermont. So in 2018 we made a number of acquisitions in Massachusetts, Halifax, Nova Scotia, as well as another one in New Hampshire. So we went from essentially $4 million of annualized revenue to approximately $15 million US of annualized revenue. So from a growth perspective, it was quite significant for us during 2018.
So you exceeded your revenue and your acquisition targets in 2018?
We really had two targets that we had set out at the end of 2017 as it related to 2018. The first target was an acquisition target where we said we'd do up to 4 acquisitions. We made 5, so we did exceed that target. The other was the annualized revenue or our recurring revenue run rate, as we refer to it, which we measure in US dollars. We had indicated that our target for 2018 was a $10 million US revenue run rate. We achieved that, actually exceeded that by June of 2018 and closed the year approximately 50% higher than that target.
So how do you plan to take this growth to the next level in 2019? What's in store at Leap Health?
There's really 3 focuses for us for Leap. One, organic growth is very important for us. It's an area of focus. Obviously, we're acquiring businesses that historically have been profitable over the last 10 to 15 years, so they have a good track record. We have a good management team and a good staff in place and a great caregiver base, and so that's very important to us. So we'll continue to grow those companies as standalone businesses organically. 2, is to continue with our acquisitions. And I think what people will start to see is that we're starting to acquire some of our competitors. And so we're consolidating not only a part of the industry, but also within a geographical focus, which is important for us. And the third is potential for joint venture partners. So we're always looking for other business owners or entities within a space like hospitals where we could potentially do a joint venture partnership with. We haven't done one yet, but that would be the third avenue where we see potential for growth during 2019.
What is your strategy to make all these acquisitions that you make work for you and integrate successfully within the core business?
I think there's a couple of things. One is when we're looking at the businesses, we're looking at the people that are within the business. We're not acquiring facilities or real estate. We're really acquiring a great management team, a great caregiver base, and a client base, right? So they're really intangible assets, but to us, the most important assets. So as long as we have consistency in values, so in other words, the way that we believe people should be treated, the training that we believe should be implemented, particularly around dementia training, as long as there's a consistency with the management teams that we're acquiring, then those businesses are attractive to us. We tend to go into secondary markets or rural areas. That's been important to us. I think it's been a strategy that has worked well for us. Less competition, great access to people that are willing to work and provide service within the home, terrific referral sources, great clients. So that's a strategy I think that's worked well. And we've got a great team at the head office which helps with the integration of these businesses. Our value, I think, at the Leap level is really as a supporter to those that are in the local markets. That's really what it's all about. I mean, at the end of the day, we want to support our caregivers who are providing support to our clients in the home. And as long as we see ourselves in a supportive role to the agencies we've acquired and we lay out the strategy in terms of from a growth profile, I think we'll continue to be successful.
What are the factors that are driving the market opportunity in the home healthcare space?
Well, demographics clearly is the main driver. We're looking at really the beginning of the baby boomer generation. I know it's been happening for a few years now, but we have an aging population, and as a result of having an aging population, we have people that need assistance in some form or fashion within their home. Now, they have choices whether or not they can go to an assisted living facility or nursing homes as examples, but what the studies have shown is that for the most part, people really want to remain in their home. they've raised their family there, they're more comfortable there, and so we provide the service that effectively allows them or enables them to remain in their home. But we also provide service around transportation and errands and activities of daily living, and a number of other non-medical and medical services.
Okay, and lastly, Chris, do you have a message for investors and potential shareholders for this year?
You know, I think the message for shareholders, existing shareholders, or for those that are potentially interested in investing is this. One, we've demonstrated our ability to grow the company. Two, we've really proven our ability to attract good businesses, to close on those businesses, and to integrate those businesses within the broader Nova Leap organization. Our stock performance last year throughout 2018 was an increase of about 56%, which I think is a pretty healthy return for those that were invested at the beginning of the year. And given our growth profile and given where I expect us to take the company as a management team, personally, obviously, I think it's a very attractive time to become involved in a Nova Leap story.
Wonderful. Chris, we wish you break many more revenue targets this year. Thank you so much for your time.
Thanks for your time. Appreciate it.